mental illness has hit society. It's called bipolar disorder or manic depression. Here today, we have Dr. Preston Thomas, who has been studying this disorder for a long time now. Welcome, Dr. Preston Thomas.
Hi, Lindsay.
So, Dr. Preston Thomas, what is this bipolar disorder?
Well, bipolar disorder is a brain disorder that causes unusual shifts in mood, energy levels, activity levels, and the ability to carry out day-to-day tasks. The symptoms are very severe and when left untreated can result in damaged relationships and poor job or school performance. When bipolar disorder is treated, people with this illness can lead full and productive lives.
We also have a therapist in with us today. Please welcome Dr. Taboo. Now, Dr. Taboo, what causes this disorder?
Well, there are many factors that doctors think cause bipolar, and here are some of them. First of all, bipolar tends to run in families, and research suggests that people with certain genes have a higher probability of developing bipolar disorder, but researchers are not sure exactly what kind of genes those are. Small-town twin studies have indicated that there is a substantial genetic contributor to bipolar disorder. Scientists are trying to figure out what genes are involved, but there are no answers yet. Brain chemical imbalances. Neurotransmitter imbalances play a key role in many mood disorders, including bipolar disorder as well as depression. Neurotransmitters are chemicals that facilitate the communication between neurons, which is brain cells. An example would be dopamine, which is in your brain. Lastly, environmental factors. Abuse, mental stress, or significant loss in your life or some other traumatic event may contribute towards bipolar disorder.
Doctors often say that people with bipolar disorder often lead to physical changes that occur in their brain. Can you expand on that, Dr. Preston Thomas?
Yes, well, modern technology has allowed us to look inside people's brains more than we were able to before. fMRI and CAT scans allow us to take pictures of the brain. One study using MRI found that the pattern of the brain developing in children with bipolar disorder is similar to that of children with multidimensional impairment. Now, the symptoms of these disorders overlap with each other as well as schizophrenia. This suggests that brain pattern development could be linked to unstable moods. MRI study found that the adults with bipolar disorder tended to have a smaller and less functioning prefrontal cortex than adults who didn't have the disorder. So, as you can see here, by the highlighted indication, this is the prefrontal cortex, and it functions in solving problems and making decisions. It matures its connections with other parts of the brain during the adolescent years, which may indicate why this disorder emerges when people are in their teens.
What are these signs and symptoms?
Common signs and symptoms include feeling unusually high and optimistic or extremely irritable, unrealistic, grandiose beliefs about one's other abilities and powers, sleeping very little or feeling extremely energetic, racing thoughts, jumping quickly from one idea to the next, highly distracted, unable to concentrate, acting reckless without thinking about the consequences, and hallucinations in extreme cases. But not everyone with bipolar disorder has these symptoms.
Wow, I better get myself checked out. We'll be back after this short break. Also medications, right?
Yes. Mood stabilizers are normally the first choice to treat bipolar disorder because it helps keep your emotions more stabilized. Here is a diagram showing how this is the neutral territory, and people without bipolar disorder, their emotions normally waver a bit from the neutral line but always come back. People with bipolar disorder tend to go way up and then drop. They don't spend much time in the middle. And so up high is what we call manic, and down low is depression. That's why it's called manic depressive disorder. And mood stabilizers help keep them closer to the normal mood changes that day-to-day people experience. Typical antipsychotics are sometimes used to help treat symptoms of Certain types of these medications will be given to either mania or manic symptoms. And then to treat the symptoms of bipolar depression, sometimes antidepressants are used. The problem with using antidepressants is that it can increase the risk of switching to the mania or hypomania stage, and it also risks developing rapid cycling symptoms. There are many side effects to these drugs and these medications, so some people with bipolar disorder choose not to take them.
So just to clarify, rapid cycling bipolar disorder occurs when a person has 4 or more episodes of major depression, mania, or hypomania, or mixed states all within a year?
Yes.
What kind of therapy is there to offer?
Well, there is psychotherapy, which is just plain talk therapy. During therapy, you talk about your feelings, thoughts, and behaviors that are causing your patient problems. Talk therapy can help you understand the problems that prevent you from functioning properly in society. But there are also 4 types of therapy. Behavioral therapy focuses on behaviors that decrease stress for the patient. Cognitive therapy is a type of approach that involves learning to identify and modify the patterns of thinking that causes the mood swings. Interpersonal therapy involves relationships and allies to fix any problem that the illness causes. And lastly, social rhythm therapy helps you develop and maintain daily routines.
Bipolar disorder, when left untreated, ups and downs can be devastating. So it is important you get help early. Often medication is not enough for treatment. It is important to educate yourself about the illness so you know what to expect. Make sure you have good communication with your doctor and therapist. Tell them honestly how you're feeling so they can help you. And adjust medications accordingly. Stay on treatment. Even when a bipolar patient is feeling well, it is important to stick to your treatment to help keep relapses under control. Having a strong support system is important to help the patient have hope. So a healthy lifestyle is essential for the treatment to work. Just like mood swings, treatments have ups and downs. Finding the right treatments takes time, so you have to be committed to getting better. You can see from this report, bipolar disorder is a serious yet treatable disorder that many people face in today's society. We hope you learned a lot from today's segment on illnesses. Thank you, Dr. DeBoo and Dr. Preston Thomas. To you, Jim.